Guys, welcome back to the channel. Merry Christmas to all and advance Happy New Year. Okay, so last class we have started with the biology of metastasis and we have seen the five stages of that. First one was invasion, second one was entrance, third was survival, fourth was escape from the circulation into a new tissue, and fifth was implantation in the new tissue. This is all मेटास्टासिस का बायोलॉजी विच इन टर्न मीन्स कि ट्यूमर कैसे एंटर करता है फ्रॉम एंटरिंग टू द इम्प्लांटेशन. ओके, नाउ it is estimated that only 1% of cancer's metastatic attempts are successful. मतलब सिर्फ 1% मेटास्टासिस होता है इन शॉर्ट. ओके, नाउ metastasis is explained by the mutagenicity of the cancer. The longer the cancer goes untreated, the more likely one or more of the cancer cell will accumulate the additional genetic mutation, that is oncogenes. जितना डिलेड होगा ट्रीटमेंट उतना ज़्यादा oncogenes का accumulation होगा. Okay, now metastasis of oral squamous cell carcinoma is most likely to the regional lymph node of the neck. Cancer that have metastasized from the anterior floor of the mouth, anterior alveolar ridge between the mental foramen and lower lip will appear first in the submental triangle lymph nodes along one of the anterior digastric muscles. तो अब हम स्पेसिफिकली पढ़ रहे हैं कि ओरल स्क्वामस सेल कार्सिनोमा कहाँ कहाँ मेटास्टाइज करता है फ्रॉम द डिफरेंट रीजन. तो मेनली वो रीजनल लिम्फ नोड्स पे मेटास्टाइज करता है, ठीक है. लेकिन फिर स्पेसिफिकली जो एंटीरियर फ्लोर ऑफ द माउथ है, एंटीरियर एल्वियोलर रीज है, दैट इज बिटवीन द फोरामेन, mental foramen and lower lip will appear first in submental triangle lymph nodes. Okay, that is level 1 along with one of the anterior digastric muscles. Now, cancer located more posterior in the floor of mouth, the oral tongue, the buccal mucosa or the alveolar ridge between the mental foramen and retromolar trigon. तो mental foramen और retromolar trigon के बीच वाला will appear in submandibular triangle, that is level 2. Okay, now coming to the cancer that appear in retromolar trigon, tonsillar fossa and pharyngeal tongue will often first appear in the retromandibular or jugular digastric lymph node, that is level 3. So according to the region of the oral cavity, anterior, middle, posterior or anterior, posterior, most posterior, the the cancer will goes into the regional lymph node 1, 2 and 3, level 1, 2 and 3 respectively. Okay, squamous cell carcinomas arising from nasopharynx area metastasize to the posterior digastric lymph node around the spinal accessory nerve, that is level 5. So arising from nasopharynx, it will go into level 5, that is posterior digastric lymph nodes. Each of these nodes is referred to as the sentinel node for its respective tumor location. इन सारे नोड्स को क्या बोलेंगे? सेंटिनल लिम्फ नोड फॉर देयर रिस्पेक्टिव ट्यूमर लोकेशन. Okay, when a squamous cell carcinoma does not metastasize via blood-borne route, it will most often go to the lungs. If numerous lung foci are found, then metastasis from the oral primary site is more likely. अगर बहुत सारे lung foci हैं, तो it is more likely that metastasis is from the oral primary site. And lung metastasis from an oral site is often multifocal, obviously. The mechanism of oral cavity primary site metastasis to the lung is via the venous system. तो oral cavity का primary site metastasis is to the lung is via the venous system. Okay, that's all for today's class. We'll be dealing or continuing this in the next class. Till then, like, share, subscribe and comment. Bye.